During labor, there are lots of different birthing positions that one can go into to help relieve pain during birth, and also just, birth the baby. So this is my friend Taryn here, and we are going to demonstrate a few of those labor positions. I'm going to instruct her on some of those positions. So first one is we are going to do the pelvic tilt on hands and knees. So with that, Taryn, I'm going to have you come on your hands and knees. I'll grab the pillow. So yeah, you can go ahead and go onto your hands and knees. We'll make sure that this can show you. So you're going to be on your hands and knees there. And I want you to go ahead and let your pelvic kind of tilt up. So pull your top pelvis up to the top of the ceiling. Perfect. And sometimes it can be nice to lean forward onto to do this on a birthing ball or a bed. So it can take pressure off of this area, or even like a chair, just leaning forward and allowing your pelvis to tilt in a way that kind of relieves that pain a little bit. So from here, we're going to go into our second birthing position, which is kind of like the child's pose if you've ever done yoga. So it's the open knee chest position. So you're going to come on down to your elbows, or so for this one, so yes, come down to that can be good too with your hands out there. It might be nice to have your elbows pulled in a little bit so you can rest your head, and just having your pelvis up in the air and pushed back. That can relieve a lot of pain on the pelvis, and just help your cervix area to open up for birthing position ideas or just for comfort. Next, we are going to be using this pillow, and Taryn's going to demonstrate the side lying position. So Taryn, I want you to go ahead and just lay on your side. And so we're going to so generally we do want to have a pillow here for the head. And so we want to have what she's doing here with her arm is good if that's comfortable, the lower arm. It could be comfortable to also put it up next to your head. And this arm generally can be anywhere as that's comfortable as well. But between her legs, so we generally want to keep the cervix area open. And so between her legs, move around here, we would open up her legs and stick a pillow in here or even a peanut ball, things that will help to keep her outer leg elevated, and which can not only keep the cervix open, but help to relieve some pain as well, because the weight's being distributed somewhere else. And the last one that we're going to show is the semi-prone. So you can kind of go from the side lying to semi-prone when one is becoming a little bit uncomfortable, kind of merge between both if you have to stay in bed. So with the semi-prone, you're kind of lying on your stomach a little bit. So Taryn, I want you to just go ahead and start out lying on your stomach. Though if she was pregnant, lying on her stomach would not be too good, so we would start her kind of like this. And so there would be lots of pillows involved here. So kind of lean onto your opposite side there. And right here where her leg is, we would have her bend her leg up and rest it on top of pillows. So it would be up and she would be nice and elevated here. So there's not putting pressure on the stomach. And so it's keeping everything elevated here. And then additionally, she might like to have some pillows here to keep her just everything, that whole left side elevated. And she can keep switching sides depending on what she likes. And so, yeah, those are the birthing positions that I'm demonstrating today.